The president went on national television recently and promoted a drug called hydroxychloroquine to prevent and treat COVID-19 coronavirus infection. Many of my patients have asked me, what do you think, Dr. Jim? Do you think this is really the real deal? Is this going to work to prevent and treat COVID-19 coronavirus infection? Here's what I answered. First and foremost, it's not been studied. In order to put a medication out there, give it to patients, prescribe it for patients, it needs to be rigorously studied. Science needs to get behind it, and science needs to get behind it before the FDA will approve it. It's not been studied, and therefore no one can say if it's effective or if it's safe to treat COVID-19. Remember that Hippocrates told us, first, do no harm. Second, do what's in the best interest of the patient. So at least for this time, I can't agree with the notion of maybe we should give it a shot. Let's try it. Maybe it'll work. Hydroxychloroquine is an immune suppressant drug. It suppresses the immune system. That's why it works to treat disorders like lupus and rheumatoid arthritis, because in those patients, the immune system is out of control. It's in disarray. And so the hydroxychloroquine suppresses the activity of the immune system, and therefore it's effective against lupus and it's effective against rheumatoid arthritis. Fighting COVID-19 requires that we have an intact, highly performing immune system in order for it to be effective, to fight off this virulent virus. And it defies logic and science that it would prevent, if you're taking an immune suppressant drug, a drug that suppresses the immune system, that it would prevent a virus like COVID-19 coming into your system when you're and not infecting you when your immune system's impaired. It just really doesn't make sense. It's just not logic. And who will know? Who will know until it's researched? And remember this: hydroxychloroquine is not soda pop. Hydroxychloroquine has many serious side effects: cardiac arrhythmias, which can be lethal, fulminant liver failure, bone marrow suppression, and blindness, to name a few. And while it may or may not prevent COVID-19 coronavirus infection, its serious side effects may preclude its use to prevent COVID-19. I wouldn't recommend it to my friends or my loved ones. I certainly wouldn't take it myself, and I cannot, in good consciousness, prescribe it to my patients. I can't imagine saying to them, well, you didn't get COVID-19, but now you're blind, your heart's in rhythm problems, your liver's failed, and your bone marrow doesn't work. Just doesn't make sense. Remember my mantra. It's what Hippocrates said. First, do no harm. Second, do what's in the best interest of the patient. This is Dr. Jim for Be Healthy, Be Happy. Think twice before taking hydroxychloroquine to treat or to prevent COVID-19 coronavirus infection. And at least for now, I'm giving it 2 thumbs down.